All right, good to go?
Yes, good to
Oh,
go.
all right. So good evening to everyone from Michigan. I am Shannon McMorrow, and I am really excited to be joined by four colleagues who we will say good morning to. It is very early in the morning. Four colleagues from Naresuan University in Thailand. So let me go ahead and share and then make this bigger. So the title of our talk today is here. It's Drivers and Impacts of Climate Migration in Thailand, an examination and discussion from a public health lens. And we have a really esteemed panel. Again, I'm really honored and excited to be able to present together. So maybe if you don't mind, I'll have each of you share your name and then I can just share a little bit more so we can start with Palm.
So, good evening, everyone. My name is Pantit Pintumpet. I'm the Deputy Dean for Academic Affairs.
Awesome. Thank you so much. And Dean?
Okay, good morning and Swati from Thailand. I'm Associate Professor Dr. Nitha Kittiravuttiwong from the Faculty of Public Health, Naresuan University. Nice to be here. Thank you very much.
And Ramnalin?
Hi everyone, I'm Romnalin. I'm from the Faculty of Public Health, Naresuan University. I hope you never heard the name of Naresuan University, but today it is the day. Nice to meet you all.
And then did we lose Tik? Oh, she's there.
I think she has left, but she will be right back. I think there's,
Okay.
yeah.
Okay. So we have an additional colleague who will be joining us, who is also from the Faculty of Environmental Health. And as you can see, the panelists are also leaders in the Faculty of Public Health. So Dr. Nitra is the dean. We also have the associate dean for deputy dean for academic affairs, assistant dean for research, and assistant dean for academic affairs. And then I am an associate professor in interdisciplinary health programs at Western Michigan University.
Shannon, and we have Sudawadi right back in the room here with us if you'd like to.
Okay.
Yeah.
Do you want to just briefly introduce yourself? I can go back here. Oops. There you go. Oh, I think she went out again.
She's here.
Again. Okay. Teek, do you want to introduce yourself or? There you go.
Would you like to introduce yourself? Sudawadi?
Okay. Hi, everybody. I'm Stawadi Asaka. In Naresuan University, Thailand.
Great. Thank you
Yeah.
so much.
Okay.
So as background, and especially for the understanding of the perspective that we are offering to you today, I wanted to just share very briefly about how we came to be collaborators and colleagues working on this presentation together. So recently in 2025, I had the honor to be able to join the Faculty of Public Health at Naresuan University for a month to work on planetary health was the main focus. So I'll talk a little bit about that, but we spent a month together in Thailand and really had a chance to start some of the conversations that you'll hear about today and some of the work that we're sharing about. So, like I mentioned, the focus of that collaboration was planetary health. And this is something, some people may be familiar with it, but just in case you're not, I would share that it is the general concept is that human health and the health of the planet are inextricably connected. So this of course, is not a brand new idea. This is something that is really rooted in indigenous philosophies and ways of being for thousands of years. But in terms of an academic context in an academic area, it's something that is relatively new and that really came more into the forefront about 10 years ago when the Lancet Commission issued a report on planetary health. And within that broad concept, a key focus within planetary health is looking at climate change and really looking at it as a main key driver of so many different harms that are present within both harm and to the health of the planet and also to humans. So again, I share this to let everyone know that this is really where we're coming from. We are all faculty that are in public health, so we're not migration scholars or people that focus on international development, but we're really coming to it from a lens of looking at public health and looking at some of the public health impacts overall of both climate impact in general in Thailand and then also migration within that context. So I will go ahead and turn it over to Pum.
Thank you, Professor Shannon. So I think good evening, everyone, even though it's morning here in Thailand. And thank you again for having me. I'm from the Environmental Health Department from the Faculty of Public Health. So I will talk a lot about the environment that changed during the climate change. So I will zoom out on the global climate risk pictures and then narrow down into Thailand hotspots over through a public health lens. So around the world, climate hazard, for example, heat waves, floods, storm, and droughts are intensifying, and they're not affect all the community equally. The public health footprint is already visible. For example, like heat illness and excess mortality, malnutrition when crops failed, waters and vector-borne diseases after floods, and mental health impact from those disasters. These hazards are also shaping human mobility. Disaster and climate stress are now significant driven of internal displacement, often interacting with economic and social pleasures. Most movements start short-term. For example, people leave during the extreme heat spells or after flood. But when hazard repeat or recovery lacks, displacement becomes protected, with families moving multiple times or settling in new places. So in the next slide, I think you can see that why this matter for public health, because the displacement disrupt continuing of care, crowded emergency services, and the stain wash system. I've been reading the article recently. The stain wash stand for water, sanitation, and hygiene that would affect a lot when climate change happen. For example, like when we have the overload of water resources from flood, it will intermediately affect sanitation and hygiene of the people. It's widening inequity for the poor and the elderly, outdoor workers, and migrants. So I think the key takeaway from the global evidence is this: climate mobility is not just an environmental or migration issue, it's a preparedness on health equity challenges. So with that in mind, let's look at Thailand. So Thailand also exports in highs, and while readiness is improving, the window for action is urgent. First, heat. Bangkok. I don't know if each of you guys here ever visited my country or Bangkok or even our hometown, Phitsanulok. So the first effect on climate change that we expose these days is heat. Bangkok and other large cities show clear urban heat island characteristic. As hot day increase, risks rise from outdoor worker, older adults, and people with chronic diseases. We've seen impact on productivity, ER visits, and cardiorenal stress. Next, the second issue is that flood and salinity in Chao Phraya River, which is the huge river that's run through Thailand from the north through the middle of the country. We have the evidence that they amplify flood risks during the climate change, and flood can contaminate water and trigger outbreak. Saline intrusions threaten water quality and agriculture in low-lying area. So you can see from the next slides that the third problems that we have in Thailand is drought, variability, irregularly rainfall, stress, agriculture, and household income, noting seasonal rural to urban movement and adding pressures to urban services. So what should we do as a public health response? So I think we should prioritize. For example, we should have heat health action plan in major cities. A lot of things will help, but I think the most important thing is early warning, clear list communication, cooling shelter, employer guidance for outdoor worker. That's just an example. And the search playbook for heat and flood. I think those can help too. And those health can be protected by public health system, and of course education is play a very crucial role. So if we frame climate mobility as health preparedness, we can reduce illness and death now, lessen forced displacement, and make necessary movement safer and more dignified. And next, our beloved Dean, Professor Nitha, will zoom in more in our climate change affect our town, Phitsanulok province, and she will tell us about the plan of our town and our country to respond with climate change. Thank you very much.
Thank you, Pam. Sawasdee again from Thailand. I'm Associate Professor Dr. Nitha Kittirawuttiwong. It is my honor to be here with our colleagues from Naresuan University. This activity that we are going to expand our experience on public health and planetary health with the International University. Climate change impact to all, including maybe the native, the people who live in the country, the tourists, the migrant, according to the topic that we are going to discuss today. From my public health lens, I come from the community health department of our faculty. I saw the climate change will be make the people to maybe collaboration, both the people who live in the community and other organizations that they need to work together because of it is our city, it is our country. And the city need to have a plan and work, and the country plan. This is the thing that we are going to sharing for today. We are going to present for our experience with the encounter with the storm and the response from the city and country. Go to next slide, please. We will provide for the information of our country profile. From Thailand in 2022, the country have the country economic is characterized by the GDP around 500 and maybe 63 billion. We have the GDP per capita of the people around $8,000. And for the economic structure, the country relevant on the service sector like the maintenance, the hospitality and accommodation, the financial sector. And the country has the population around 70 million. Bangkok is the capital of our country and recognized as the travel hub in ASEAN. And therefore, the tourism rank of our country is the first rank that Bangkok is the most city that people would like to maybe visit it for. Therefore, we are going to be in the level rank of upper middle income country. And then go to next slide, please. We are going to maybe focus on our city, Phitsanulok province, located in lower northern part of Thailand. According to the climate change, the water level was rise since 2024, and the water river is already above the average of the bank, therefore increasing the risk of flooding. In 2025, this year, we encountered with 3 tropical storms, Vipa, Boloi, and Matmo, which leading to flooding of our city. Next, please. The government tried to design a system of warning information. This is the first of new alert system of our country. We received the warning announcement from meteorological departments that done by the government. Receive an alert of message. Community member have the time in order to manage of their assets. The government start the SMS short message services to send out of natural disaster warning to all by mobile phone. This is the first of nationwide SMS warning in Thailand after a big earthquake that we have encountered, and then the government tried to give the information to all people by the SMS via the telephone system. And then next we are going to see the flooding in the city. In this year of October, the city that I live in, Phitsanulok, have experience of flooding. I lived there for 22 years and have never experienced for flooding in the city. This is a photograph that the people in the city know as this is Suan Chom Nan, the park with border near the Nan River. This park is open for all age for exercise and recreation. And we have the feature iconic symbol of the city, such as the train station, locomotive, the tricycle, and the long drum dancing. Professor McMorrow have visited there. And then the river reached to be over high of the bank and causing the river is overflow and flooding occur in our city. This arrow show for the increasing of our water level in the river. Next, please. And for when we encounter with the flooding in our city, you can see the river in the city is increasing. The flooding impact to the city, the community, the people and animals who live there. My community have flooding with the lower level around 20 centimeters. The water leaked to the garden and did not overflow to inside my house. My family and I use the pump that borrow from our relatives to drain the water from our garden to the street and utilize the free sandbag that we got from the community as a barrier. We had run the pump every 2 hours for 2 days. When the city have enough pump in order to allocate our resource to every house in the community. And I observed that you can see the picture in roti near the animal, near the cat. I observed that community members join together at the public space. Mostly of Thailand, we use the public space at the temple. Everyone join to feel the sand and the community wide square. That if we have the public space in our community, they prepare the sandbag to everyone for free. And for after we flooding, then when the water decrease, for the high flood Revel area. Next, please. The provincial rescue team evacuate the residents, the pets to safety zone established by the municipality. Additionally, the relief bag was distributed in the short term for those citizens who choose remain in their homes. Water and electricity were cut off in the severely affected area. This is the organization that they are going to work together. And then after the river has decreased in the next slide, the municipality staff clean up the city. The staff also clean the street along with the community member in front of their house. Next, I draft the estimate cost analysis for individuals that impacted by the flooding. I did not standardize for the cost because of impact vary among people. The cost that I try to draft related to the waterborne disease, if they had to take care of themselves after they got that disease due to the flooding, the medical that was lost in the flood due to the people, some of the people missed medical appointment due to the difficulty to travel when they encounter with flooding, and the mental health stress, and the general economic burdens, maybe around 3,500 baht each person. And if we have estimated and predict for everyone in the community, it will be impact for our economic burden. Next. This is the city organization role in the flood response that I try to maybe capture from our experience. Firstly, the core responsibility may be the municipality. This is the organization that in Thailand we allocated resource to local organization. They play a crucial role for direct action and have a plan that's what relevant to evacuation, safety shelter and supplies, protective planning and restoration after flooding. Additionally, the Department of Disaster Prevention and Mitigation are going to maybe operate and implemented immediate relief measure. And for the healthcare services, need to focus on emergency medical response and public health services. And the military provide the critical logistic and manpower support for all organizations. This is all organizations that relevant when we have the flood in Thailand. And we go to the pathway and action to build resilience in 4 pathways. The first one is we need to maybe have a foundation of our success is regarding the mobilization, society, knowledge, governance, and education for all to have the responsibility and acknowledge for their roles to work together. And the second, the safe and healthy communities. This pathway is focused on protecting people and well-being and enhance the heat preparedness and resilience of flood and public health system. And then we need to balance the resilience of biodiversity, species, and ecosystem to make the environmental, the people, the animal to live in the city and in the world. And the last one is climate-ready economic infrastructure. This pathway is relevant to the future-proof physical assets and core economic functions. Next, please. For the national strategy on climate change in Thailand, we monitor for the climate change performance index. Thailand commitment to be carbon neutrality by 2050 and net zero emission by 2065. According to the climate change index, Thailand is in the medium rating and was improved in the score and ranking. When consideration on each dimension, we found that the country lowest rank in the dimension of renewable energy. And we are going again to the country profile. For the country profile in the next slide, we found that we have the wide area around the 50 largest of the country in Southeast Asia, and we have 77 provinces divided of the demographic administration in district, sub-district, and village. Our capital city is Bangkok. We are in the tropical that influenced by seasonal monsoon winds. That we have the season. We have the rainy season, the winter, and the summer. The main annual temperature was increased in 2021. And go to the next slide for the country profile. We have the mountains, the population around 70 to 71 million people. We are in the edge society. We are in the upper middle income, so that we have import the neighborhood migrant, and we have the edge society, so that the vulnerable group are in our country. Therefore, preparing for everyone who live in the country is the challenge for our country, and the remaining emission and emitted in our country are from the industrial process and product that we use together with the waste management sector. Next, please. The role of climate change in Thailand. We have a plan and the target for our country. We start maybe the 20th century with our plan, and we try to set our aim to reduce greenhouse effect. And in 2050, we are going to achieve carbon neutral for our target. And 15 years in the next, after we achieve carbon neutral, we are going to achieve net zero greenhouse gas emission. And the next is the SDG index in 2025. If we focus on SDG 30, we found that we are going in the stagnant process. The critical focus must be directed to reduce the number of dead and missing persons due to disaster. Is the crucial information that we need to use to be the evidence to improve our plan to achieve our target and reducing the overall of greenhouse gas emission. And next, for the policy recommendation, firstly, we need to enhance SDG outcome and driving implementation. And we are going to move for the greenhouse gas effect mitigation, both in the short term, that we are going to maybe improve our data collection. Is the evidence to support to improve for renewable energy adoption according to the previous slide that we found that the ranking of our country is the lowest in the renewable energy use. And we are going to follow the midterm and long-term action plan for decrease of greenhouse gas emission. And for the policy recommendation, lastly, we are going to the next slide with the climate resilient adaptation. For the short-term priority, we need to update national disaster management system and incorporate nature-based solution concept into the government policy. We found that the disaster management system, we start with the SMS message that warning people for all who live in Thailand. This is the climate change is occurring more frequently and high of intensity that impact to the people. People live in the community are going to be cooperate with the government. They are going to be made to have the awareness and empower them. Is the crucial role of public health practitioner. And early warning system information, the plan to promote positive environment are essential both at the community and country level. And we are going to move for the impact of the climate change to the migrant that Romnarin are going to discuss with us later. Thank you very much.
Thank you, Dr. Nitra. Yes, we heard about the climate change. It's in our front door right now. So I'm gonna move to the climate migration, how it affects the human who live in this region. So please take a look at this beautiful river, the Mekong River, where people live, grow, and depend on its flow for survival. This river connects our region, Cambodia, Laos, Myanmar, Thailand, Vietnam, and China. And there are more than 250 million people living here. Across the ASEAN and Great Mekong sub-region, climate change is no longer distant. It's lived reality. It shapes how people move, how they work, and how they survive. Yet this region is one of the most climate vulnerable places on Earth, and this region is this region is right in the heart of Thailand, a country that feels the impact in every flood, every drought, and every disruptive livelihood. Next slide, please. So Thailand ranks among the top 10 most climate affected countries globally. We live with floods, as you can see from the photo, droughts, even wildfire, but they are becoming stronger, more frequent, and less predictable. When a storm hits, it's not only building that collapse, but it's livelihood, mental health, and family stability. Just a few months ago, not a few months ago, actually just a month ago, a tropical storm hit this region and it affected Thailand also. It's caused devastating floods in 15 provinces in Thailand, including Phitsanulok, where I live in. Roads were impassable and some communities were cut off from healthcare. And these events are no longer rare. They have become new rhythm of our climate reality. So go to the next slide. Let me tell you how people in my region make a living. We rely heavily on agriculture. Almost 1/3 of Thailand workforce are in agriculture, forestry, livestock, and fisheries. So when rains fell or floods destroy crops, communities lost income, and sometimes their sense of identity also lost. Because our ecosystems are connected by the Mekong River, as I show you in the first picture. So what happened in one country soon affect another workers. So climate migration is not abstract, it's already happening now in our region, Cambodia, Myanmar, and Thailand. When droughts or flood destroy crops, people move and many come to Thailand, where I live in. A study from International Organization of Migration Thailand found that migrant workers, especially sugarcane farms, migrated here to Thailand because of the drought at their home and their heavy flooding in their home, so they cannot make the living. So migration become their only adaptation strategy, their way to survive here in Thailand. Go to the next slide, please. You saw it bad already, but it's not only that. It's not only the rural agriculture sector that under risk. Our urban areas are too. Bangkok and its surrounding province, home for around 15 million people, including many from our neighborhood, Myanmar, Laos, and Cambodia, face rising seas and extreme heat. Sea level rise means nearly 4 million residents already live in flood risk zone. In the worst case scenario, the number could double. So even the place that people migrate to for safety and for a living is itself becoming unsafe. Imagine a farmer in the Northeast or a farmer from Vietnam or Cambodia. The rain don't come, so his rice field crack and turn to dust. So he borrowed money to plant again. But the drought returned, the debt still rise and hope fades. So he decided to move to Bangkok or suburban area to work in the factory. But the flood hits the city and his rented room filled with water. So he cannot work and he cannot send money home. His family waits, but the remittance never come. This is climate migration, not just number, but stress, separation, and survival. So we move to the next slide to see the number. Not number yet, I'm sorry. So this is the main cause for climate migration in my region. So we have environmental drivers, we have economic pressure, we have sectoral vulnerability. Let I tell you, we are rely on agriculture, hospitality, tourism, and that sectoral are under vulnerability. And we also face the disaster displacement. So let's move to the next one. Yes, those reasons drives us to move away from our motherland. But even the more urban area like Bangkok, we are also under the risk. So where people gonna move? Now let's see the number from the next slide. Yes, let's look at the data from the International Organization of Migration. Across the lower Mekong subregion, more than 60.8 million internal displacement have occurred due to disaster. And among 9 million people were forced to move because of extreme weather events like typhoon, monsoon, cyclone or hurricane in the Philippines. Over half of these, about 53%, took place right here in Lower Mekong region. You can see peaks linked to even like Cyclone Nagis, Typhoon Haiyan in the top right of the photo, and severe flooding in Vietnam and Myanmar from 2008 and 2023. These situations make people move, and most displacement happened in Myanmar and Vietnam, and 19% in Thailand. But please imagine, those people from Myanmar, Vietnam, Cambodia, they always move to Thailand, but Thailand have to move itself. We have nowhere to go. Let's see the situation just only in Thailand for the next slide. Yes, this is the number of internal displacement linked with disaster in Thailand between 2008 and 2023. So we have 3.2 million people internal displacement, mostly due to flood and storm. And flood affect more than 2 million people every decade, and drought hits the most rural province hardest. Just this year, it's not the end of 2025 yet. We suffer from many floods and heavy storm. And many people have to lose their home, economy. And I don't know, like in the future, how can we gonna survive and adapt in this kind of extreme climate change? So go to the next slide, please. Yeah, let's step back to the human level. Let me conclude the situation before Professor McMorrow gonna talk about adaptation. So we are under extreme and unpredictable weather, from floods to droughts, affects those who produce our food and sustain rural economies. Many people have to move. Migrant workers also move to Thailand, and Thailand themselves have to move to the other country also. People from our neighborhood have long come to Thailand to work and escape from conflict, not only climate, but also conflicts and their political instability. And yes, for people who were already poor and vulnerable, this impact can be devastating, ruin their livelihood, and destroy their assets. To move forward, we must think together through policy, research, and compassion. Let's now hear more about the policy implication and call for action from Professor Shannon. The floor is yours.
Thank you so much to everyone preceding me. So picking up where Professor Ramnalan left off, this is just a brief discussion of some of the impact on the populations that have already migrated to Thailand. So, as we just heard, there's a lot of movement within the country, but also from other countries in the region. So at the moment, or most recently, the estimate was about 5% of the total population of Thailand are people who have migrated. So that includes refugees, asylum seekers, and economic migrants, which would be the majority of that 5%. In addition, again, this was already mentioned by my colleagues, but Thailand is also a transit state. So people at any given time may be moving through Thailand or staying in Thailand temporarily as they're migrating within the region. And then there is also the people that are refugees and are in settlements, sometimes also called camps, along the Thai-Myanmar border. So the estimates are roughly 125,000 refugees across 9 different camps. But that, of course, has been a long-standing conflict, and there's been long-standing pattern of movement of people that have escaped Myanmar and come to Thailand. So estimates are about a little less than 2 million people from Myanmar in Thailand at the moment. And then again, as my colleague mentioned, there's Cambodia and Laos that have people that are moving to Thailand or transiting through Thailand. So the picture in the gray on the bottom left, where the red dots are kind of marking where those different camps generally are located. And then, of course, there is, as this was already mentioned, so just kind of strengthening this point, but the vulnerable populations are the ones that have disproportionate impact, and that includes people who have already fled or migrated from other places to live in Thailand. And there are already lots of different unmet healthcare needs. And this can be for all migrant populations, but the author there recently looked at people who migrated to Phuket to work in the fishing industry, which was mentioned by my colleague as a major area of employment. But when people move to the country, there can be different even if they are employed, there are challenges with accessing the healthcare that's needed. And then, of course, disasters and different climate events impact that further. And then some of the other issues, again, these have already been mentioned, but it's just recognizing that these populations also exist that have migrated and have additional impact. So the sanitation challenges that are presented, access to clean water, the uptick in infectious diseases and increased risk and exposure for infectious diseases, and then, as my colleagues mentioned, mental health, including post-traumatic stress disorder, are all part of the kind of milieu of the different kinds of health conditions and health impacts that people can be experiencing at one time. So this is a photo from about a decade ago, but just giving an example of people that are in a settlement or a camp area and how they're managing and having to work with a flood. So in terms of one area that Thailand is offering something that can be of interest to other countries. Other countries are doing this, but they have adopted it again for over several years. The IOM has the Migrants in Countries in Crisis Initiative, which has guidelines and capacity building for protection during disasters, including climate events. And in the region, the Royal Thai government was one of the very first to adopt the initiative. And so the way that that looked on the ground is that 170 officials and 1,500 community members were trained to ensure that disaster preparedness and responses included the needs of everyone in the population. And there was, again, so 1,500 community members would be kind of a broad swath of the community, but there was intentionality in making sure that the training and the needs of migrants were part of the picture and part of the capacity building. So that is just a snippet on that. Of course, that could be a whole each of the things that we've shared are a kind of a broad view of many of the different parts of the conversation. So I hope that has been of interest to you, and I think we'll move on and do our conclusion, and then we'll open it up to have questions if people have them.
Thank you for Professor Shannon. As we come to the conclusion of this presentation, I would like to emphasize that Thailand is highly vulnerable to the impact of climate change. This is no longer a distant concern. It is a reality that we are already facing over the past year. We have seen clear evidence of rising temperature, unpredictable rainfall, coastal erosion, and more frequent extreme weather events. These changes are affecting both the environment and the economy in profound ways. Communities across the country, especially those in low-lying and coastal areas, are at great risk. Many people may lose their home due to floods, storm, or sea level rise. At the same time, the financial costs are immense. Each major climate-related disaster cost Thailand millions of US dollars in damage and recovery expenses. This losses not only economic but also social and emotional, impacting people, stability, and well-being. Moving forward, education and preparedness are key. Encouraging climate literacy and promoting proactive adaptation measures are essential steps for local organizations, national institutions, and community. When people understand the risk and know how to respond, they become more resilient and better prepared to protect themselves and their surroundings. On an individual level, small actions can also make a big difference. Reducing plastic use, conserving energy, and supporting environmentally friendly practices are simple but powerful ways we can all contribute to reducing climate risk at the nation level. Thailand should continue strengthening community resilience and government readiness. Effective disaster management system, climate responsibility policy, and support for affected populations, especially those displaced by climate-related disasters, will be crucial. In conclusion, addressing climate change requires cooperation from every sector of society. If we act collectively with awareness and determination, Thailand can move toward a more sustainable and climate resilient future. Thank you. Thank you for your attention. Please.
All right, wonderful. Thank you so much to everyone. So we've covered a lot of ground. We started with Dr. Pem, who was talking about and offering the and a public health perspective and some of the key parts of how we view climate impacts and also some of the solutions that we talk about from a public health perspective. And then we moved on to Dr. Nitra, who gave a very important, unfortunately, case study of very recent and current experience that's going on and has been going on in Pitsanulok, where Naresuan University is and where our panelists live and make their home. And also we learned about a little bit more about the different levels of strategy. So both municipality strategies and government of Thailand strategies across different categories in terms of addressing climate. And also she shared some good data in terms of areas for improvement for Thailand and where the rankings are right now. And then Dr. Ramnalin shared a lot of also great data in terms and also experiences and talking about really the zeroing in on the focus of migration and what's going on, especially within Thailand, and numbers of people moving and capturing some of the events and climate events that have been leading to that movement, and also really reminding us of the urgency of the issues and that they're not in the future, but they're really things that everyone is experiencing at the moment. And then I offered just a brief snippet on the considerations for the people that have already migrated to Thailand or are in transit in Thailand in terms of the public health impacts of climate disasters and how there are those are vulnerable populations, and thinking about some of the different public health intersecting and multiple public health concerns that can occur. And then again, one of the initiatives that has been undertaken in terms of trying to have inclusion and consideration for migrants in terms of mitigation. And then finally, Dr. Tick gave a wonderful conclusion for us to really think about the way forward and across again, all of the different sectors. So we are talking from a public health perspective, but certainly you hear the interdisciplinary and multidisciplinary, some of the language, and there's the recognition that this is a multi-sectoral approach that's needed. And that really brings us back to where I started in terms of planetary health. When I talked about that, it is something that kind of originated a bit within public health, but it's truly something that is following the same the same urgency for having interdisciplinary, multidisciplinary, and multi-sectoral collaboration to address planetary health, including climate change and then also migration. So I'll pause a minute and see if anyone has any questions. I'm not yet seeing any, but maybe people are formulating them. All right, no questions so far. So maybe I would ask, it's not a hard question at all, but maybe if people feel comfortable sharing just a little, it's really, I know it's very vulnerable and hard to talk about the experience of the recent flooding, but I'm interested to hear more about even just the perspective from your life in the university and how students managed that, or you talked about community participation. What kinds of things did the students do in the context of that recent flooding? Any?
Okay. I would like to share about the responsibility of the student when they have the flooding. Firstly, for the emergency situation, when they found this one, they need to be maybe go to the safety shelter that the university can provide the safety shelter and maybe the relief bag in order in the short time period that they are going to face with the flooding in the university or in the community around the university. And then in Pisanulok the situation of flooding may be only the heavy rain. The situation of the high level of river, maybe there are 20 or 30 years happened once, and now 23 years that I live there, this is the first time. Therefore, only the immediate of flooding due to the heavy rain. Therefore, the warning system that the country try to warning according to the information via the SMS. This is the thing. If they have this information, they are going to the safety of the shelter that the university provide. And then after the relief from the flooding system, the thing that they are going to maybe save for our community, our planet, maybe they are going to have the education relevant to safety of our environment, including how do we reduce for the carbon dioxide emission. And we are not only focused on the carbon dioxide emission, maybe the methane. The methane are going to be maybe occur from the landfill. Therefore, how to reduce of waste management is the thing that we are going to give the educate for all the students in our university. This is the thing that we need to have them to manage for the active response, resilient after their encounter with these problems. And then for the long term, education awareness for all students need to be done. And for the university level, need to have a plan for take care our community in the university. And for the university, we have mostly of other discipline. We need to work together with the all faculties in our university and work together with the municipality in order to expand of our work from community to the city. This is the thing that the role of university empower the students to take care of themselves, provide the infrastructure, mobilizing of resource because of the university have human resources to work together with the municipality that have the financial resources. This is the provincial level. And then after we can take care of our provincial, we can expand to our regional and our country to work together. This is the role that I think it is important for the university to work together with other sector and increasing the education awareness and planning. Thank you very much.
Thank you. And I would make sure to point out that from my recent experience that the Faculty of Public Health and you as leaders and Dean as the leader are really actively working on that. So even just as kind of sharing more about some of the planetary health work we did together, Dean Nitra, along with the other leaders here, led a process of having a direct meeting and really presentation to collaborate with the municipality. This was, of course, in July in advance of the flooding. So it was part of this ongoing, the collaboration that she's advocating for is what she's actually doing, and something that's already being addressed. And of course it takes more, and it takes, many conversations, but that conversation was initiated, and I think with time it's something that will continue, and you have done it in other areas of the Faculty of Public Health as well. I wish, now that I'm of course thinking about it after, but even in terms of what you mentioned when you were showing the pictures of the city, I wish that we took some pictures of us where those painted murals were, and it's a very good benchmark to see where we were standing, and where you could see, the whole, what part of the mural was covered compared with where we were standing, and then the water levels that you just showed. It's not helpful that I'm saying it now, but for the next presentation, we'll include it, because I think it's helpful to see as a comparison. Anybody else want to have any other additions about student, it's really more, or not more, but thinking about student reactions or student during the actual situation earlier this month? Like, did classes get delayed at all, or did it impact the university, the business of the university?
So it's actually affect the city area because of the Nan River. It's run through the city
Okay.
area. So our university is quite far from the Nan River. But the
Mhm.
problem is you can see the water rise up every day. As a civilian, I've driven from the city to work, and I have seen the water like full on the river, which never
Yeah.
seen before. So I think when it's come to class and talking to the student, it's like risk communication. What we going to do if the water sort of like go to the towns, and where is the elderly or people who in need, something like that, I think. So when it's come to climate change, some things that I think what we can do is that prepared for outcome that going to affect health. And those environmental health and public health can go together. And as you visited our town, you can see that we have the vulnerable area along the river where we have the house and even the temple, so that could be affected by the flood as well. Yeah.
Thank you so much. I'm still not seeing any other questions for us. Do you have any questions for each other? I would say also just, and it's not really a question, but a reflection, but I can ask you the same, but as I'm, as we're doing this and working on this, I'm thinking about how to share more about what we talked about today with our students. So while I think we talk about different parts of what we have addressed here, I'm thinking about how to talk a little bit more specifically about migration and climate events, and kind of how those intersect, and then also the really specific public health concerns. I don't know whether you address that in any programs specifically, or is it more general?
You mean that the program relevant to planetary health, public health, or environmental health of our faculty? I would like to give you all the program for the others.
Yeah, well, it's more like across. So I of course have an
Mm,
insider point of view, but across, so for
mhm,
community health,
mm,
environmental
okay.
health, all the different places. Is there
Yes,
space for talking about
yes,
climate migration
yes.
specifically, or migration and climate and those things together? Because for me, I'm trying to think more about how I can infuse it into places where I teach, but I don't know whether if there's the opportunity across your faculty of public health.
Yeah, yes. This is for this session, I think it is very maybe expand our perspective. Mostly of the public health that for the graduate student, that are the healthcare practitioner who work in the community, the hospital, and then they need to maybe expand their expertise, including the migrant, because of the migrant are the one who are going to maybe working at the social service to increase our GDP. Therefore, we have the productivity. We have upgrade our country to be the upper middle income, so that the one of the students that they are working maybe the border area. For the slide that you see for the camp, we have the students who working in this area, such as Tak province. This is the border area with Myanmar. Therefore, they need to take care of them because they are the human rights and the increase of our GDP. We need to work together. We need to improve our subject in the curriculum, maybe the elective for the postgrad student for planetary health. It needs to be make a discussion in the city, in the country, and for the international health and planetary health in order to make them have the overall of the planetary health and impact for all. If we focus on the socio-economic status, it may be impact for the poor and the rich. It may be impact to all age. It may be impact to all citizens for the native and for the migrant. Therefore, we are going to develop the elective for planetary health for the undergrad student and for the postgrad student. And for the undergrad, we will use the material that you are going to work together with our faculty. We produce the education material in English in order to make them to improve their English, to understand that the discipline of public health, occupational health, environmental health, applied traditional medicine, and community health are relevant to the planetary health. And this is they maybe have understand their roles for the undergrad student. And for postgrad student, we are going to develop the elective that I have previous presentation that make them to understand their roles and make them to expand perspective to cover the native, the migrants. These are the ones that they are going to have responsible for healthcare services. And for the public health practitioner, they need to collaborate and mobilizing resource to improve health and well-being of the people that they serve. That are the things that we are going to ask our colleague as a team to develop the plan like this.
Yeah. Wonderful. Well, I think if I'm still not seeing other questions, so I think we can close. I am so grateful to each and every one of our panelists. It was a very early morning, and now they have a long day of work ahead of them. I'm also grateful to those of you that joined us for the panel. So thank you so much to everyone. And please reach out. So our information is there in the program. And if you have questions that you think of later, or you want to kind of start a conversation about anything that we've talked about, I think we're open to receive your questions. So I wish everyone the panelists a great day. And thank you to Krishma for our support. And everyone else, if you're in Michigan, have a good night or have a good rest of your time wherever you are.
Thank you.
Thank you too.
Thank you. Bye.
Thank you.
Bye.
Thank you.
Thank you. Oh, you're muted.
Thank you very much for Charisma Bakari for organizing. Thank you, Memoro, for invite us, for all of us from Naresuan University to join. Nice to work
Yes,
together with you. Thank you very
yes,
much.
for sure. Have a great day and we'll talk again.
Yes,
Thank
yes, thank you
you.
very much.
Okay.
Thank you.